Dear friends, welcome back to my channel Alpha Physio Pelvic Care, all things pelvic health and beyond. My name is Anastasia Varova and I'm a pelvic floor physiotherapist specialist here in sunny Cyprus. I work with both people online and offline, and I also work with all the genders. Today, I would like to talk about a specific tool that is used also in a specific condition. Namely, I would like to talk about vaginal dilators. If you are watching my channel, if you keep watching my videos, I would greatly appreciate if you press that follow button and also like button. If you do have questions, feel free to ask them in the comments and I will be more than happy to answer them. Vaginismus is a condition that I'm dealing quite a lot. And today I would like to talk about a specific treatment, which is vaginal dilator, and to tell you 3 important things that you need to know about vaginal dilators. A very fast introduction, what is vaginismus? It's a condition that affects pelvic floor in women where muscle goes in an involuntary spasm where penetration is attempted. It can be penetration as in a sexual act, it can be penetration as a gynecological checkup, it can be use of tampon or anything. The muscles go into spasm and the person usually do not have conscious control of that, even if they feel like they are happy and okay, either to do a gynecological exam or to have a sexual intercourse with their partner. Like in their mind, they're ready and they're fine, but the muscles contract involuntarily. This condition can be either primary, so a woman always had it since she tried to attempt any type of penetration, or it can be secondary. So a woman could have any type of penetration, but something happened. It can be an event, it can be a sickness, it can be a treatment or anything else, a trauma, and suddenly she finds it very difficult to have any type of vaginal penetration. In the physiotherapy world, vaginal dilators is something that is advised to use during vaginismus, and you usually start with a smaller and slowly progressing. I myself do and did and do still prescribe vaginal dilators. I find they're generally great, they're really helpful, but there are certain rules that you need to adhere in order to make them and their use successful. In this video, I will assume that you had diagnosis of vaginismus, that you seen someone, and that you have been advised using dilators by healthcare professional. I would strongly not recommend just try and buy vaginal dilators just off the market and get on with them by yourself. You certainly need a guidance. And although those 3 points that I will tell you today are pretty much universal, and I'm telling them to most of my clients, there are still very individual variabilities when you use vaginal dilator. Remember that you can also have your consultation about vaginal dilator online, and you can make a plan on how to use these dilators. Or maybe you can have a diagnosis from OBGYN and then go and see a pelvic floor physiotherapist live or online in order to develop a longer term strategy. Just before we jump on the 3 main points, don't forget to like, subscribe, and remember, vaginal dilators are not the only and the sole therapy for vaginismus. Vaginismus is a complex condition. It's also to be considered dysregulation of nervous system. So in my practice, only a couple of times maybe it happened that the woman would use only dilators and she would use them progressively, successfully, and that's it. And she would be able to have penetrative sex, or she could go and do normally her gynecological checkup without any pain or discomfort. Usually it's a combination of dilator therapy, of physiotherapy, of relaxation techniques, breathing techniques, quite often psychotherapy. So whatever needs to be done to work on all levels, on physical and mental, in order to help you with the condition. Now, let's get to the points. Number 1, and honestly, this is not rule set in stone, but I would like always to tell to my clients, start with the smallest dilators. Dilators, I have here my set of dilators, and to be honest, these are quite simple and quite fast progressing. So there are only 5 pieces. Smallest one is this big and the largest one is this big, okay? So there is a very small gradient between them. It all depends on the person and what is their request. If they can't use a tampon, but for example, they can't have penetrative sex, then you might want to start with the middle set, because some dilators, such as intimate rose, not an advert, but these are the most popular dilators, are coming in a set of medium, small and large, and within that set there are 5 or 6 pieces of dilator. Whichever set you get, no matter how tempted it is to start with something bigger and see, oh, if I can get this one inside, I would always suggest to start with the smallest one. The reason for that is you will feel more in control. Being in control of your body and of the action that's happening will relax you, will give you the freedom and realizing that you are controlling the penetration, okay? If you are starting with the largest one, you might experience some pain and discomfort, and it can scare you, draw you back from the dilation therapy, and you might think, maybe not. So always start with smaller one. Maybe it's going to be so easy, you will immediately progress to the next one, which is fine to progress to the next one straight away. But the starting point, smallest one. Rule number 2. I have seen this before, that the woman would have a set, whether it's a medium, small or large, and the dilators within that set, or it's just set of dilators, and she would try to get through all the dilators or more than 2 dilator size through one session. There would be very, very specific cases when I would say that it is okay. Otherwise, I would not suggest to try to go through the whole dilator set. You might feel internal pressure that you have to get to the largest one. And second of all, you might get yourself so sore that by the end of the session, you will really not look forward to the next dilation session. Start with the dilator that you are on right now. Let's say you're on the smallest one and you start to feel that smallest is really easy. I can do that. You can, within the same session, progress to the next one, and if you need to digress back to smallest one, that's fine. But please try to avoid to go from the small and bigger. Let's try the bigger one. Let's try the bigger one. It might sound really exciting, especially as you're progressing. Wow, I can do it. Let's try it. But give your body a time. Believe me, if you have a very, very steady progress, you will have more sustained result. And rule number 3 when you work with dilators: forget about timeline. If you go to a doctor or to a therapist or whatever, or on the internet, and they say, within 3 months you're gonna have pain-free penetrative sex, within 1 month you will be able to put tampon, or if you receive set of dilators by a healthcare professional and they give you timeline, for me it's a red flag. Every single person is so individual, and I really do not want to put any pressure, absolutely unnecessary pressure, on that person to progress at a certain time frame. There will be times when you will be missing your dilation sessions. There will be times you will be sick. There will be times maybe you will be tired. There will be times when you have heavier period. There will be times you might have a UTI, an infection, and you want to stop your dilation session. There will be different things that might happen. There will be time when you will be really progressing faster than usual. So the progression curve usually might go like straight with a little ups and downs, but as soon as you stick to your plan that you have developed with a healthcare professional with using dilators, and you stick to this plan and you go steady with it, you will achieve small goals that you set for yourself. But please, please do not be strict with yourself and with the timeline. From my professional experience, there are women who use dilators for 3 months. They were able to have penetrative sex. They got pregnant. Great news. There were women who used dilators for almost a year, and then they had pain-free gynecological exam. Absolutely amazing feeling when my client tells me that. So there is a very various timelines, and please do not put yourself within certain frame. I hope, guys, this video was helpful for you. You got some insights about dilators. Maybe this is only something that you are still considering. Maybe you didn't get any. Maybe you would like to have a more detailed video on how to use dilators or which one to choose for each case. Please let me know, and if I get enough requests, I will absolutely and definitely do some more videos on vaginal dilators. Thank you so much for watching. Thank you for your likes. Thank you for the subscription, and we will see you back very soon. Bye.